Assalamu alaikum. Our lecture today is about osteomyelitis, presented to you by Dr. Rasha Asafi. The objectives of this study: the definition of osteomyelitis, the etiology of osteomyelitis, and the morphological changes of osteomyelitis. Osteomyelitis denotes inflammation of the bone and the marrow, always secondary to infection. Osteomyelitis could be complication of any systemic infection, but most frequently it manifests as a primary solitary focus of disease. So it could be secondary or it could be a primary. All types of organisms, including viruses, parasites, fungi, and bacteria, can produce osteomyelitis, but the infection caused by certain pathogenic bacteria and mycobacteria are the most common. The pathogenic osteomyelitis usually is almost always caused by bacteria and rarely by fungi. These organisms reach the bone by number 1 hematogenous spread, number 2 extension from contiguous site يعني فد مكان قريب اللي هو carry the focus of infection قريب من البون, number 3 direct implantation after compound fracture or orthopedic procedure. ممكن يكون احنا يعني يصير الامبلانتيشن او احنا نزرع المايكرو اورجانيزم بداخل البون اللي هو نسميه implantation after compound fracture بعد ما يصير له fracture او اذا كان سوينا فد orthopedic procedure فد عملية inside the bone وكان الفوكس is not sterilized. In healthy children, most osteomyelitis is hematogenous in origin and develop in the long bones. هذا بالchildren. In the adult, osteomyelitis more often occur as complication of open fracture, surgical procedure, and infection of the feet in the diabetics. The organism Staphylococcus aureus here is responsible for 80 to 90% of cases of culture-positive pyogenic osteomyelitis. So the most common cause, bacterial cause, here Staphylococcus aureus. طبعا these organisms express cell wall protein that bind to the bone matrix component such as collagen and facilitate adherence to the bone. يعني هاي المايكرو اورجانيزم تسوي لنا expression او عندها certain wall protein اللي هي تقدر تتحد وتلتحم بالماتريكس of the bone وتسهل attachment to the bone. Escherichia coli, Pseudomonas, and Klebsiella are more frequently isolated from individual with genitourinary tract infection. إذن دول اللي عندهم genitourinary tract infection وصار بي dissemination to the bone, الكوز مالتهم هم الإيكولاي, السودوموناس and Klebsiella. ودول اللي هم who are intravenous drug abusers. دول two categories اللي يصير عندهم الانفكشن هو الكوز مالته these bacteria. Mixed bacterial infection are seen in the setting of direct spread or inoculation of organism during surgery or into open fracture. يعني ممكن يصير عندنا mixture of all of these إذا كان عندنا هاي three situation. In the neonatal period, Haemophilus influenzae and group B streptococci are frequent pathogens, and individuals with sickle cell disease are predisposed to salmonella infection. يعني إذا احنا حكينا عن كل كاتيجوري، حكينا عن النيونيت، حكينا على الأوبن fracture، حكينا على الأورثوبيديك سيرجري، حكينا على الانترافينوس drug abusers، حكينا على those who are عندهم UTI. كل categories of each category of those patient or person, they have certain type of pathogen that can cause osteomyelitis. هاي الفكرة. In almost 50% of suspected cases, no organism can be isolated. The osseous vascular circulation, نقول osseous يعني blood vessel اللي يغذي البون, which varies with age, determine the location of the infection in most long bones. In the infant and adult, vascular communication allow the spread of infection between metaphyses and epiphyses. Metaphyses اللي هو the center of the long bone, والepiphyses اللي هو قريب من ends parts of the bone which is near the ends of the bone. By contrast, the vascular growth plate in child interrupt the infection spread between the metaphysis and epiphysis. Now the morphology. The changes associated with osteomyelitis depend on the stage, whether it is acute or subacute or chronic, and the location of the infection. من نقول subacute يعني احنا عندنا infection لكن البيشنت ما عنده أعراض، بعد ما مستشعر المرض، ما ظهر عنده pain، ما صار عنده swelling، ما صار عنده any signs of or symptom of inflammation. So subacute it is subclinical stage. الأكيوت اللي هو الأعراض من تبدي تظهر، والكرونيك اللي هو after prolonged period of infection. Okay, and the location of the infection. بالacute phase, the bacteria proliferate and induce a neutrophilic inflammatory reaction. Necrosis of the bone cell and the marrow ensues within first 48 hours. يعني يبدي النكروسيس بعد 48 ساعة من الانفكشن. The bacteria and inflammation spread longitudinally. يمشي بصورة طولية مع طول العظم. And radially throughout the Haversian system to reach the periosteum. يعني الانفكشن يعبر الهافرسيان سيستم اللي هي وحدة تشكيل البون، يمشي باتجاه أطراف العظم radially إلى أن يوصل إلى البريوستيوم. Periosteum is the first layer from outside in the bone. The periosteum is the beginning of the bone أو قشرة العظم الخارجية. Lifting of the periosteum further. بعدين هذا الانفلاميشن لما راح يوصل البريوستيوم راح يسبب لنا فد ارتفاع بالبريوستيوم because of edematous fluid, inflammatory infiltration, the necrosis. فراح يسوي لنا lifting in the periosteum، يرفع البريوستيوم. This will impair the blood supply to the affected region. طبعا blood supply ما راح يوصل إلى المكان بسبب الانفلاميشن والaccumulation of the necrotic tissue, contributing to the necrosis. The dead bone is known as a sequestrum. بهاي الحالة راح يصير عندنا focus of a dead bone اللي نسميه sequestrum. Rupture of the periosteum lead to soft tissue abscess. طبعا with time accumulation of the pus of the sequestrum راح يصير عندنا rupture للبريوستيوم. البريوستيوم أو الطبقة الخارجية من العظم راح تنفجر وتسوي لنا تروح للsoft tissue اللي هو surrounding البون وتسوي لنا abscess. And this can channel يحفر فد channel to the skin. راح ينفتح هذا الابسس to the skin creating a draining sinus. Sometimes the sequestrum crumble يعني يتجمع releasing fragments that pass through the sinus tract. ممكن هذا السكوسترم يبدي يطلع فد pieces عن طريق هاي الساينس tract إلى الخارج عن طريق السكن. In the infant and uncommonly in adult, epiphyseal infection may spread through the articular surface or along capsular and tendinoligamentous insertion into the joint. إذا ممكن إنه يروح للجوينت مو فقط إلى السكن ويسوي لنا struct, producing septic or suppurative arthritis, and this can cause destruction of the articular cartilage and permanent disability. Morphology. Continue with the morphology. After the first week, chronic inflammatory cell will release their cytokines that stimulate the osteoclastic bone resorption. شنو يعني osteoclast? Osteoclast, these are the phagocytic cells present in the bone اللي هي تساوي الماكروفاج. اوكي. resorption امتصاص العظم راح يبدي عندنا بسبب الاوستيوكلاست اللي هي stimulated by the cytokines secreted from the inflammatory cell in the region. Osteoclast cells start to cause bone resorption and in growth of fibrous tissue. تجي الفايبروبلاست تسوي لنا laying down of fibrous tissue and the deposition of the reactive bone at the periphery. يبدي reactive bone يتكون at the peripheral side. The newly deposited bone can form a shell يعني مثل shell of living tissue يعني layer أو رف أو فد شيء خفيف جدا نسميه known as involucrum. Okay. Around the segment of devitalized infected bone. يبدي هذا laying down of a shell يعني شلون نقول قشر البصل shell of living tissue يبدي يتكون حول الفocus of inflammation or the infected bone. The histological finding of chronic osteomyelitis are more protein but typically involve myelofibrosis, sequestrum, and inflammatory infiltration of lymphocyte and plasma cell. إذن هي عبارة عن fibrosis, sequestrum, و inflammatory infiltration of chronic cells أو chronic inflammatory cells. هذا هو resected femur in the person with draining osteomyelitis. طبعا من نقول draining يعني الاوستيومايلايتس مفتوح على السكن، صار عندنا drainage part أو opened part to the skin. The drainage tract in the subperiosteal shell of a viable newborn involucrum. هذا النيوبورن اللي تشوفوه، هذا الشيل اللي واقع بالحفرة، اللي منتصف الحفرة، هو يعني تكوين البون الجديد. shows the inner native necrotic cortex السكوسترم، والسكوسترم أيضا موجود inside the أو اللي هو necrotic bone موجود inside the same focus. Mycobacterial osteomyelitis. Overall, approximately 1 to 3% of individuals with pulmonary or extrapulmonary tuberculosis show osseous infection. إذن اللي هم عندهم pulmonary أو extrapulmonary tuberculosis راح يصير عندهم Mycobacterial osteomyelitis. The organism usually blood-borne and originate from a focus of active visceral disease during initial stage of primary infection. Direct extension from pulmonary focus into the rib or from tracheobronchial node يعني lymph node into the adjacent vertebra may occur. The bone infection may persist for a year before being recognized. طبعا الميكوبكتيريا ممكن تبقى inert for years. The infection is usually solitary except in immunocompromised individual. The finding histologically هي caseous necrosis and granuloma اللي هي typical of tuberculosis. The Mycobacterial osteomyelitis tend to be more destructive and resistant to control than pyogenic. طبعا تكون more resistant and severe treatment is needed. Tuberculous spondylitis اللي نسميه pot disease is a destructive infection of the vertebra in which the spine is involved in 40% of cases of Mycobacterial osteomyelitis, and the infection breaks through the intervertebral disc to affect multiple vertebrae and extend into the soft tissue. Thank you very much.